Good to be chatting with you here, talking about RingCentral and Lava Technology Services and how the partnership is working and being cultivated in the channel here. And really what RingCentral is bringing to healthcare organizations. That's really what we're going to be kind of focusing and honing in on today. Lava, we work with a bunch of different industries, but we've kind of honed in a lot in healthcare recently, and we're
Mhm.
doing a lot with a lot of healthcare organizations, not just hospital systems, but healthcare organizations, fertility clinics, spine and pain type of clinics, and everything is about the patient experience now, but also the customer experience, and the customer being the internal customer. How are you making those agents want to stay there? Because there's a lot of turnover within the agent community and in the contact centers in general. So how are we leveraging technology so that Ring is making those internal customers very happy with their job, very easy to navigate, very easy to get answers pretty quickly. So pretty pumped to work with you today and hear
Sure.
what RingCentral is doing to help in better health organizations. So if you want to just do a quick introduction of yourself, and then I'll kind of get kick started into it.
Sure. Thanks, Billy. Really appreciate you being together today, and looking forward to talking to your team in the future. My name is John Poli. I am the industry principal for healthcare at RingCentral. That role is primarily a sales go-to-market role. I'm enablement role across all the segments in sales. That's a global strategy role. So I drive how we take our platform and our services to serve the healthcare market, again, across all payer, provider, and life sciences. So that would be pharmaceuticals and drug development and stuff as well. I've been with Ring about 5 years. As I told you earlier, before that, it's been about 7 years with Gartner. About half my portfolio was large-scale healthcare provider and payers in the New York City to Boston region, Northeast. And then before that was about 5 years as a CIO at Delta Dental, so about 15, 16 years senior leadership in healthcare. Again, when you talk about RingCentral, just to help your team kind of set its structure, RingCentral is the largest pure play UCaaS provider. Your team probably knows this pretty well, but also we're obviously a CCaaS provider across the board. And you talked earlier about kind of the spectrum, everything from the single user's phone and what you're doing with, a full multimedia environment there, voice, video, messaging, digital fax on every device, all the way up through contact center. We have a number of options for both CX and RingCC, which is our partnership with NICE, on up through webinars and events. Our whole suite of communications tools are available underneath our SaaS partnership. So we're really proud of the breadth of services that we're offering. We just launched about 5 new products on the New York Stock Exchange last week as well. So it's been a very busy week for us. Always trying to innovate in space. So I'm happy we'll be talking about all that today, I hope, in context of healthcare. And again, as we look at the market, to your point, Billy, we see a ton of the whole spectrum. We see enterprise hospital systems, large-scale clinics, large-scale dental service organizations. We see specialty clinics. Behavioral health is very strong. Long-term care, assisted living, health at home services. We're seeing all of that in play and a lot of growth. Healthcare is the largest subvertical in Ring, and it's the fastest growing. So it's a very, very powerful place for us right now, and we're doing a lot of investment in the space as well in terms of leveraging our APIs and our next generation of products. So we're very excited about that, and I'll take it as you ask the questions, but there's a lot to talk about.
That's awesome, man. Quick introduction for myself, Billy Stowe, one of the co-founders here at Lava Technology Services. Lava stands for Louisiana and Virginia. I
Oh,
am from Louisiana, as you can tell, my LSU banner behind me.
sure.
I live in Virginia now with my business partner Jake and our team, but originally from Louisiana, and very proud of that. But what we really do is we help enterprise businesses, which includes healthcare and even some government now too, evaluate the global market of all things as a service. So we're going to come in, we're going to evaluate where are they at today, where are they looking to go tomorrow. Can we save them some dollars to enhance technologies and really save them the time of doing the market research themselves, which might take them 6, 7, 8, 9, 10 months. And we do that in 6, 7, 8, 9, 10 weeks. Just really, we have a lot of information and a lot of true power at our fingertips to help them make those decisions quickly, to help get those implemented quickly, right? So that some of the problems that they're facing aren't going to take 6, 7, 8 2-3 years
Hmm.
to actually get done, right? So let's help them do that. And part of that is UCaaS and CCaaS of some of the things that we work with. And I'm really excited to talk to you today with RingCentral being one of our strategic partners here and learning a little bit more about not only RingCentral, but also what are you doing within the healthcare vertical.
Sure.
And I'm curious, maybe to kind of kick us off here from like RingCentral's perspective, how do you think the role of voice within healthcare for both UCaaS and CCaaS environments is like evolving because you have patients who they're increasingly expect like not only seamless but faster turnaround times, faster information, omni-channel because a lot of folks nowadays don't even want to pick up the phone anymore. They don't want to talk to a human anymore. But they still want that answer pretty darn quick. So like, from your perspective, how do you see the role of voice evolving within healthcare, specifically of what you guys are doing?
Well, it's funny that you mentioned that. So there is we think voice has become kind of the new, we call it the new UI, the new user interface, because the irony of AI has turned it back, the digital experience back to a voice experience, but that's a digital experience. It's an automated voice, an AI tool. But let's just start from what you're saying. Yeah, first things first, we saw as as healthcare centers start to look at the cloud, one of the first areas they looked at, it's our targeted areas, we call it patient engagement, but it's basically that contact center, that front desk, right, that first engagement with the community at large where a health organization, a hospital system, or a contact center is talking to the population of patients. And we've seen that evolution, first being, I want to be like the best social media company. I want you to, like an Amazon, I want you to know what I like. I want you to have context. I want you to understand what I bought last time, why I was here last time. So that construct of having to your point, multiple channels of access. If you want to do text, you want to do messaging, you want to do bots, we want to do all that, support that. And we also want the context to be understood. We want that history to be captured and understood. So next time you call, we know what Billy talked about last time, and we can bring it up in the agent. So you promote that information into the discussion, right? So you start to have a certain amount of intelligence. Generational AI is really helping that more and more. So that was the first phase we saw. And then obviously the construct of really moving towards a situation where we could do some automation at the patient engagement. So where we see the evolution now is really rapidly moving to IVAs and agentic AI on what we call the before call. So basically, how can I take and provide if you think about the evolution of EMRs, right, where we digitized the whole healthcare back office in the 05 to 2015 timeframe through the government's mandates, everybody put in technology and that's where Epic became a monster and all these big groups, and the EMR became the ERP system for healthcare. And that digitalization was great. And then everyone said, use portals. And we've been trying to do that for 10 years, but there's limited use of portals. And with multiple doctors and multiple specialties now, as healthcare is specialized, how many portals can you expect a patient to kind of log into now? We found that the new evolution is that with IVAs, we can take all that portal technology and take all that information and just feed it to a smart AI engine. And through an IVA, all that data is now translated to the person anywhere they want through a voice exchange, on top of obviously text messaging and other omni-channel environments. So that's really one of the things we're racing to right now, because everybody's looking at that. So our AIR product, AI Receptionist, does just that. It takes all the information that you publicly provide to your community and has it accessible through a voice call. No going through different tablets, no going through multiple phases on a website, no going through IVRs or push 1, push 2, push 3. You just ask the question. What time are you open on Friday in Oklahoma City? Got it, right? It's right there. And so that kind of data being kind of distributed in a democratic way and then delivered very concisely through IVAs is where we're seeing a lot of action today. And that's really where we're putting tools in place to do that. On the second piece of that becomes what we call, our terminology is for, we call it the agentic piece, which is I now want to take that IVA, and even without talking to a digital experience, I want to speak right to an infrastructure piece. I want to connect, and this is one of the strengths of our strategy has been leverage our industry-leading APIs to connect into the CC&C layer of healthcare, the coordinated care and collaboration layer, EMRs, nurse call systems, devices, systems like Vocera badges, all that stuff, we integrate into those pieces, right? And by doing so, you can create some really integrated, tight workflows out of the box that we want to provide to our clients. So when we look at agentic AI, it's can I do that same integration with an IVA and with a digital experience. So now, can I schedule an appointment? Can I upgrade my prescription? Can I leave a note for my doctor? Can I understand my balance and pay my balance on my bill, all without having to talk to an agent? And those are all the tools we're developing as we speak today, looking both internally at our stack as well as looking at a best-of-breed platform approach with the marketplace as well. So we are building those tools today for that purpose.
Awesome. Do you see within the healthcare industry some of the pushback that we sometimes get from healthcare organizations is, well, I'm a little bit nervous to go to a UCaaS solution that's in the cloud because it relies on internet, and internet sometimes can go down, right? And healthcare can't have any downtime. You got to be able to call into the hospital. You got to be able to call into for patients, 24/7, right? So how do you guys help those organizations kind of feel a lot better about, hey, even if the internet, let's say it goes down, let's say your entire internet crashes, something bad happens, somebody cut the fiber with a backhoe, you do a lot of things, and we can't use the internet anymore. Like, how are you guys solving for that challenge that a lot of those folks are facing?
Well, first and foremost, one of the strengths of Ring is our broad network, and we have over 300 peering points in the United States. So we bring our network to you as soon as possible to basically diminish the impact of kind of long tails and other things that would be single points of failure in the network. As well, our engineering team, you can talk to us through SD-WAN, Direct Connect, Cross Connect, you could do direct lines, ISP connections. We're very flexible in the technology through which you can connect your offices or your organization to us. That being said, there's a lot of engineering behind that. We have a custom engineering team and a solutions team when you actually buy the UCaaS product that goes through detailed evaluation of what your fiber plant look like, what's your network look like? Are your hospitals or your systems connected with their own dark fiber? Do you have that asset? Do you have wireless backup, 5G, other things? What do you do satellite, right? So all those pieces, again, are mediums we can flow our services across to get us to the internet. So that's all something we look at and we build those. So you want to have the redundant carriers, you want the dual pops, you want the disperse, which is pretty standard stuff, which will really help the resiliency. But in the case of what you're saying, that's down, cells down, everything's down, we have products like Persist, which allow us to put gateways onto the facility in the event the internet fails. And that gateway basically reads the configuration of the organization every 15 or 10 minutes from the cloud. So it's relatively smart. If there's a failure of the internet completely, the phones will re-register to that gateway device and can actually, we do it because hospitals have to run no matter what, right? The emergency room, the blood bank, they have to talk to each other. So we have products that allow you to keep the hospital lights on and running in that situation in the event of a complete outage on the internet. Although we found that, our 5 nines availability of our network, we have the most confidence in the world on. We just invested even more in our infrastructure. So we think our network will pass any scrutiny in terms of its resiliency. So we're very proud of what we do, even though they call it the internet. So it's a new thing when you look into it. There's a ton of engineering resilience and history that we bring. We've been doing this for 25 years as a CLEC, so we know this space very well.
Okay, no, that's awesome. What do you? We were talking about AI before, and AI is everywhere, right? And there's like AI roles now within IT, and what that means, especially in healthcare, and what it can do. And like I was mentioning, there's typically a lot of churn, not necessarily just in healthcare, but a churn in general for a lot of these contact center agents. But how do you see AI evolving specifically in healthcare over the next 5 years to continually have patient experience at the forefront without making someone feel like they are 100% talking to a bot? But like just that collaboration from patient information, internal collaboration, and just AI delivering like measurable outcomes as well and measurable impacts. Where does Ring see that kind of evolving over the next couple of years?
Well, we just tag into the first discussion we had on the engagement side, where we see material changes. The numbers are about roughly 40% of your call volume to your front desk or your contact center could be transitioned to an IVA in terms of the normal numbers we're seeing. And that'll probably rise over time because your AI interface is going to get smarter and smarter. So the more people ask questions from October, by November, you have prepackaged solutions for those questions. And then in December, you get smarter. So it's kind of an interesting model to see where it goes. But that being said, I wanted to make clear that on all those tools, and there's a ton of tools out there in the market, clients are getting, they're getting bombarded with .ai companies. They're everywhere, and they can solve your problems for $30 a month. The challenge is we still believe the center of it is the communications infrastructure. So all the talk I had about IVA experiences and digital experiences, we still want to capture all that history when that patient says, I need to talk to an agent, and then promote that to the agent, right? So in the end, the center of the universe is that agent or that front desk operator. But think about the stress it takes off the team if all those questions they're answering every day can be put into an IVA experience, for example. Patients now get much more flexibility because they can call from their car, they can call on the way to work, commuting, they can take care of a lot of things they need to right there with the voice exchange, hands-free, wherever they need to do it. The agent then can really deal with the patient issues that are complex and that need the most attention. And so it takes a little stress off the agents, and that's a big part of kind of managing kind of the continuity of the environment and making it better for the providers, right? The agents and the people who are the nurses and administrators who staff an office, for example. The other two dimensions that we mentioned of the AI spectrum are what we call the during and the after. In the during, it's really about we call agent assist technology. So now, first of all, we're looking at tools that obviously when your call comes in, we want to pull all your data from your EMR into that screen so that agent doesn't have to hunt and peck and look up all these things in 3 different screens because we all know what that environment's like. It's high stress. So we want to make sure that if Billy Stowe goes in, his ID, whatever his phone number is, pops up, and then it's either you or your family or your dependents. We're going to look at, verifying who the patient is you're talking about. And then at that point, we want to promote most of the empirically used activities to that agent in a way they can more quickly answer your questions. With generational AI now, as you're actually talking and mentioning things with the patient on the phone, we can promote to that agent information based on that actual conversation. We can manage the sentiment analysis of what's happening with that patient. They're getting heated or upset or they're frustrated. Those are all things that are happening real time to help the agent. So a supervisor can step in, for example, or you can get a report afterwards on the quality of the call and that type of thing. So you've got a lot of stuff happening both ways. For the provider, you're promoting information, best practice, maybe protocols to patients who need to follow certain procedures for best wellness model, for example. And for the patient, they're getting better information in the exchange. They're getting informed. They're being treated contextually. So there's a certain intimacy that, you called in, they said, hi, Mr. Stowe, how are you? So it's like there's an intimacy there that we understand what's happening. And that's kind of the best experience that they're going to have there. And then the third piece, which is the analytics, what we call the conversational analytics afterwards, this construct of being able to really discreetly understand everything, and I'll again use an example. So every time Billy Stowe inquired in the office, sent a text message, got on the message tool, got on the phone, hung up, whatever it may be, that collective understanding of your experience with the office tied to the EMR, tied to your labs and diagnostics, gives a much more complete picture of a patient. And what I think is that if you look at all the industries, healthcare and your ability to communicate, empathy, and direct contact, communicate with the patient better, we think the better you'll drive wellness. We think it's a better model for care, and there's an enhanced reason to go to this tool and this technology because you can really help a patient by design. The second thing is on a grand scale, on a population side, every day you're getting a footprint of everything that was said. So you know what's happening, what the trends are. You might be having a frustrated set of customers because one of your web tools isn't working, or you've got a situation where there's something happening in the area where there's a lot of interest in flu shots or whatever it may be. You can respond very quickly to the population as a whole. So you get this macro picture that's very intimate, and you get this micro picture of the history of every patient. And then over time, we believe that becomes the vehicle for more proactive care and wellness because you now take that intimacy and you move it out. You're not hammering the front desk with all these calls on basic information. You're now turning your agents into what we call care coordinators and driving outbound proactive messaging care. And that's really how we see it evolving. It's going to take a while, but that's kind of the exciting part of where communications can impact healthcare.
Yeah. That's pretty interesting. And some stats I've been seeing is 2% of phone calls are typically screened. They're not screened, or they're listened to or judged, and for understanding of the sentiments and
Sure.
providing feedback to your agents and stuff like that. How are you guys solving for the other 98% that aren't typically by a human being listened to and after the fact from an action report? Like, what are you guys doing to help within that 98% to understand what is happening? Because that is a large percentage of these phone calls that aren't ever being touched after the fact, right?
Well,
How are you
that's the
guys
big
doing?
thing. If you only sample 2% of calls, you might miss the macro issues I just referred to. With our
Yeah.
AI tool, you can actually set up a scorecard for your agents on the things they should be doing and saying. And also you can look at, as I said, sentiment analysis. There's a number of dimensions. The client has incredible power to detail how they want to see their agents respond. We want the agent to be able to represent the mission and the culture of the provider. And by doing so, you can really tune the scripting and score your agents on it. So you're not saying, hey, I wonder what the experience was for this patient. We have the recording. We have the sentiment analysis. We understand what was said. We understand they cursed 4 times in that call, so they're pretty upset, and we didn't do anything about it. All right, whatever it may be, you can take your best practice and emulate it, because you have it by design. You can highest scores can be emulated. And then the ones who are struggling, you can coach. And so you've got a very quick way to look at everything. And we're already seeing, to your point earlier, Billy, one of the other kind of material things that's coming right away in terms of results from AI, the front end is the IVA and the reduction of need of personnel for answering X amount of calls. The second one is the ability to aggregate and understand all the calls you're seeing in your help desk. No longer do I need to sample. I'm just spend my time listening to 20-minute calls. I can get all the scoring real time. It's helping productivity incredibly in the back end. We got examples of clients in our case studies that are getting material results as we speak.
That's awesome.
Yeah, good
I'm
stuff.
actually curious. Um, One thing you mentioned kind of towards the beginning is, you have the ability from a contact center perspective to either go into the Ring contact center or your overlay of Nice in Contact.
Mhm.
Where do you typically see the need to maybe go to one versus the other within your kind of requirements gathering and understanding of the client's expectations and needs?
Great question, right? So obviously our UC product is pretty robust, and we have a lot of clinics that are running just on the UC product alone. At the same time, NICE is one of the premier enterprise contact center tools in the business. When you look at Genesis or others, they're kind of setting the standard. If you look at the Gartner, quadrant, right, NICE is right up there, if not the top one in terms of innovation and ability to execute. So we're very proud of that tool. And when we see kind of enterprise locations with complex, large scale contact centers in multiple locations and that type of thing, that tends to be where you see us leading with RCCC. What we see a lot of RCX, and RCX is really positioned to be kind of the evolution of our EX to a more kind of an aggregation. So as clinics start to aggregate, you start to grow. We're seeing a lot of CX in those places where they're evolving or they're graduating from, because someone is spending so much time on the phone, on the EX phone, that they're really acting as a contact center agent. And so why not give them the tools, the reporting, the information they need to really do that well? The other thing we see in some of gets really interesting. So one of the things we're seeing in some of the largest distributed clinics we're seeing today, they might have a large set like a RCCC contact center answering all the calls, but they want to give autonomy to their clinics because their clinics are maybe paying for it, or a lot of these large scale groups want to keep the clinic local. They want the doctors and dentists and others, care providers want to stay in the neighborhood. They want to be the neighborhood, the local place for their patients. And so they want to give them the autonomy to understand their call patterns, understand their information. So we're seeing a lot of the large scale clinics look at maybe putting a seed of CX into their clinics to augment the reporting, information, and capabilities of that clinic itself, as well as the aggregation point where if it fails over, if they need to get to the contact center for automation, they can do that as well. So we're seeing hybrid environments as well growing in the space. So, we like to say that wherever your needs are on the spectrum, we want to target the right tool for you, both from a price and a capability structure for what you need, right? And so we don't want to have kind of the static all or nothing type model. So it gives us a lot of flexibility against the needs of our clients.
Awesome. So just a couple more questions for you.
Sure.
One, and mainly because you've seen a lot of healthcare organizations out there, right? And you've seen the good, bad, and the ugly, if you will. The
Mhm.
ones that are excelling in like modernizing communications, what strategies or behaviors have you seen in them and to allow for maybe that broader healthcare industry to take from their success, because you've seen it all, right? You've been doing this for a while.
Sure.
You've
Yeah. Yeah.
been in a lot of small, big, medium
Mhm.
size. Like what are you, for the ones that are excelling in it? What are you seeing that is different, that is allowing them to continue to grow and just stay ahead of their competition, if you will?
Well, I think when we see a great mix of the operational team working with the technology team, because what you need right now, when you look at AI and you look at all the tools and the flexibility of what the cloud can give you, it's really remaking operationally how you deliver care to patients. So you need to have your doctor, your chief medical officer involved. You need to have your chief nursing officer involved. You need to have your administrative officers involved to understand the operational model, because the real bang in terms of return on investment, there's a TCO value in going to the cloud, consolidation, all those pieces, total cost of ownership. But the real return on investment comes when you can change the way you behave, and you can also change over time, hopefully, the way patients behave. Because to me, the most powerful tool against the cost curve in healthcare is a well-educated, healthy patient, right? And the more we can help communicate with them, we think it adds to that value of that patient. And so what we see in the good organizations are engagement from the operators. We see the contact center, the operations team that runs the contact center engaged every day in terms of, we'll do drive-bys where we'll sit with the contact center agents and the operational team and go through their day with them, watch them, and kind of do an ROI analysis of how long is it taking you to look up all this information and what's happening and how can we help you. So we're very precise about getting with the operations team on those issues, and then understanding, what are the care groups delivering? Are you going to have any virtual care environments in the future? How are you moving that? What type of information do you need? And then we start to have the conversations about the content of what the patient's saying. Well, that's information for a medical team as much as it's information for a technology team. And so we believe the technology team can be heroes to the operations team by bringing these types of tools to play. Where we see, on the inverse side, where we see struggles is where you still have a telephony group that's just looking to, they're not understanding the breadth of where technology can go, and they're still looking at the confines of telephones, PBXs, and those functions, because it's really a different world. And the reality is, if you need to expand the community that's thinking about these issues to really get the most value from it. And so that's where I see best practices really in that operational model going forward. And again, it's all about workflows, right? The more you have a well-documented and an understanding of how your teams work together and what their needs are, and you measure choke points and share them with us, we can really attack those things and maybe give you ideas in which to innovate in space. And we don't expect you to take all the tools I mentioned today at once, but as you look at where your most acute problem is it my agent performance and my clients, they're getting our patients angry, or is it the fact that I can't get to the front desk is my problem? Well, whatever that most acute issue is, let's attack that first, and we can incrementally add those tools and those features as you need to. And so the more you have that measured and understood, the more we can help you drive solutions.
No, we've talked a ton about contact center, and like you see it almost kind of feels in a way like just the voice part of it's being lost in translation, or being like, it's almost like in some ways not even needed. There's so many meetings that happen now instead of just typical phone calls. That Are you seeing, and this is somewhat not even just for healthcare, but just for a lot of organizations, are you seeing the use of just traditional voice where, some the guys in accounting, the people in operations, folks who maybe are not getting customer calls or outbound a lot of calls, they typically are maybe just talking to internal folks. Like, are you starting to see the need for UC for every single user starting to diminish, or is that just not something in this really is still just kind of how it's been for a long time from a
I'd say,
UC?
I mean, we're seeing, I think, strength across the board, but I'd say, as if you think about eras, right? So we can talk about the voicemail to email era in 2000, right? When we kind of switched that overnight, and then for 20 years we've been in email corporate culture, and really in the 2020, I think, as you look at it with the tools that have now been put out, particularly Teams. We have our own collaboration tools, others. It's really become a collaboration culture. And I think when healthcare really starts to adopt that culture, right, this is where UC thrives, right? It's not just the voice. I mean, voice is a critical tool and is, I think, still going to be the predominant communication vehicle. the bottom line is that now with AI, that voice conversation is much more powerful because it's not a transaction that is later on, do you take notes and you try to remember what you said to your patient. It's all there explicitly. So we're seeing a resurgence in importance of communications is that everybody has a UC system. You just look at, like, for example, we're seeing a ton of interesting care coordinators. They call a patient. They go nap on calling a patient. They could do it right out of their own phone. A lot of them are remote. They live out of their house. They're using their iPhones. They're maybe getting paid for their data plan. Well, that phone call is RingCentral. You're going to have a HIPAA secure summary of that call right there for you. They're taking, cut and pasting that right into notes. We're getting clients asking us to basically build the AI to automatically generate forms from conversations based on intake, for patient intake and summaries. We've seen this in behavioral health. We've seen this a lot with the FQHCs around outbound care management. So they have to do a ton of documentation. Well, all that documentation now can be done via the voice. So think about everybody in your organization being able to collect their voice content, summarize it concisely into, say, medical notes or things that are really concise, and then enter into systems of record. Well, you clear out all this documentation and errors that you see today in that new voice system. To me, that completely almost mandates that UC is going to be where the future is heading. You have to kind of have products like that, or else you'll just fall behind from a productivity standpoint, what the needs are. And everything's going so fast that it's important. I mean, think about healthcare. It's gotten more and more specialized. You have more and more doctors per patient out there by design. How do you collect and understand all this stuff? And for patients as well, how do they start to get that information? Think about now starting to provide patients all the conversations they've had with doctors. My parents are in their 80s. They have a ton of different visits they have to deal with. It's very hard to coordinate. And so you're giving families and patients as well more information, explicit information about what was said, what was done, and how to basically manage their care going forward. And to me, that's only going to add value to UC on an individual basis. I think when the challenge is we've built the system around the technology we had, which is we had an EMR, we had everything centralized. So let's do that. Let's do, instant messaging on the system that's built by the EMR vendor, which is great for a limit. But when you take that healthcare and then distribute it to a new population, look at new models, look at ACO, accountable care organizations, you've got different models out there now. And we think communications is going to be critical to redesigning those by design. And then I think UC is going to be central to it.
Awesome.
Of course, I'm biased.
Yeah. Well, it's pretty darn clear. RingCentral is you guys are a leader in healthcare, and you've helped me understand quite a bit why. I think that I've personally learned a lot over the last little bit, and just the little bit of time you and I have been able to share here. Like any kind of parting words, as far as something else that maybe in the future you do see coming that we haven't talked about today, or kind of the reasons why we should be all moving to that kind of unified communications as a service platform that healthcare organizations need to kind of adhere to and move towards.
Well, one thing we did talk about that I just want to mention is that one of the things we're seeing, we love in our statistics when we do our surveys of our clients, is that the provider satisfaction is usually increased because you give the flexibility to these healthcare teams. We all know the burdens they've been through post-COVID and all that stuff. You hear about shortages of nurses, shortages of doctors and specialists. This is not going to change. The aging population, the need for more care, more medication, more activity. How do we scale this structure is key, and without stressing this delivery system and these care providers into place. So we think that it really, just one of the byproducts we're seeing is that incredible satisfaction to be able to start to create new models, leverage the staff the way they need to, give them flexibility. Just the cloud alone, allowing people to be at home and do contact center. You have 20 different people in 20 different states. They can act as if they're sitting in one center. You have so much data on them, right? So that flexibility to hire, to manage, to work at home, to do other things gives incredible power in terms of the provider organizations to treat their professionals with respect and give them the tools to help them by design. So I think that's important. As we go to the future, I think the big thing is going to be continuing to look at to me, it's look at the strategic vectors, right? So we think you have to revamp your communications infrastructure. We think you also have to have a great database and EMR system. You have to have that in place, and those are evolving real time. You'll see most of those probably be in the cloud as well. So the concern about the internet is going to only magnify as most everything goes into the cloud by design. We're seeing some new innovative tools to help nurses and doctors work with patients, and so we'll see where the more we can provide great diagnostic information to the patient and the doctor at that point of care when they're communicating is really what we're all about. And so we're hoping to continue to advance tools to do just that. And then the final thing I'll say is that I just think that, we're going to see a model, as I mentioned earlier, where I think the advent of new care models and wellness models are going to be critical. And we think that a wellness model is absolutely dependent on a patient relationship with the provider with a lot of communications. And it might have to be digital in many cases, but that intimacy is going to be key to helping that patient stay healthy at home and not use precious resources in the hospital or the clinic that are being strapped at this time. So that's kind of what we see. And I think it's going to be powerful. And then, again, with the UC side, collaboration will be interesting to see how those tools start to seep into those environments. And so we're looking forward to that too.
Yeah, this is awesome, man. Well, I definitely appreciate you kind of educating me and everybody out there, and I'm looking forward to kind of putting this out there so folks can definitely understand and get to know a lot more about RingCentral's capabilities. So I really do appreciate your time, John.
Oh, thank you, Billy. Anytime you guys need us to collaborate with you, we have a dedicated team in North America across all segments. So if you need dedicated resources from our healthcare group, just call us and we'll be on it. We really see ourselves in these early stages as advisors to many clients. So the more we can educate them and our channel partners, we're excited to work together. So don't hesitate to ring us up. Pardon the pun.
Yeah, absolutely. I love it, dude. All
Thank
right,
you,
brother.
Billy. Appreciate it.
Absolutely, man.